As you may know, there has been a lot of money poured into the opioid plague that's going on in the country. In fact, it's getting more funding than anything else in this country. This came out in the Wall Street Journal, and it is dated February 26, 2018. NYC opioid crisis has cost city $500 million. Most of the expense has fallen on the city's financial strap public health system. See, financially, this opioid plague is financially breaking the country. It is financially breaking America. Mayor Bill de Blasio offered a few specifics when he said New York City litigation would seek about $500 million from the opioid manufacturers and distributors to recover costs associated with abuse of the drugs. Breakdown of that $500 million offers a window into how the opioid plague has taxed the city, with most of it borne by its financially strapped public health system. The city also has shouldered costs related to addiction treatment and law enforcement. They mean running around with that damn Narcan. Its costs cover services associated with emergency room visits, 45,000 in 2017 for opioid patients, and the public health campaigns, as well as distributing naloxone, a medical antidote to overdoses. The lawsuit follows hundreds of similar actions taken by cities, counties, and states. While the opioid plague hasn't hit New York City as hard as some regions, about 1,075 people in the city died from opioid-related overdose in 2016, up from 753 the previous year and 392 in 2010, according to city data. Deputy Mayor for Health and Human Services, Herminia Palaco, described the 500 million figure as a conservative estimate of the city's annual opioid related costs. I say conservative because it's really an estimate of things that we can quickly get our arms around. Yeah, whatever. City officials say 450 million of the 500 million fell on NYC Health plus hospitals, the public health system. Of that, 355 million is for inpatient and emergency room department care. Yeah, because so many of these people on opioids, they're not paying for those emergency room visits. Many of them are not paying. So the city has to pick up the tab. That includes about 20 million for primary and specialty care and 75 million for behavior, health, and chemical dependency care, officials say. This includes 230,000 visits to treat clinics and 18,000 visits to mental health clinics. An additional 38 million goes to Healing NYC, a city effort to stem opioid deaths that include distribution, naloxone kits, educating clinics on overprescribing, and efforts by the police department to identify drug dealers. The city has spent $9 million on opioid-related services for inmates in jail. The 500 million doesn't include costs like lost wages or economic productivity, which are included in some researchers' financial estimates of the plague. The city's calculation also don't reflect costs incurred by hospitals and healthcare providers that aren't part of the public health system. Yeah. In the Northwell Health System, the number of patients in outpatient substance abuse facilities has increased 40% in the past 5 years, largely due to opioids, said Jonathan Morgenstern, who oversees the private health system's addiction services. The health system emergency rooms have also seen more overdose patients. While the cost of an emergency room physician is typically covered by an insurance company, the influx of patients has meant busier emergency rooms and created a need for more staff. It's creating a service burden, he added. It is. It's a burden on the entire country. That's all these addicts are doing out here. I don't understand why the high IQ people aren't doing more to get them off of opioids. You're running around talking about a high IQ. Why don't you put it to use and get your people off of opioids? Dr. Palacio said beyond recoupling the immediate costs, the city's larger goal with the lawsuits and other efforts is changing the behavior of patients, healthcare providers, and drug companies. So now you really see why they are suing the pharmaceutical company, because these states are trying to recoup all of the billions and millions they have spent on these junkies. Okay. So, a spokesman for McKesson Corp, also a distributor, said it works hard to make sure opioids don't end up in the wrong hands, and noted that the company doesn't initiate prescriptions. We only distribute in response to orders that pharmacies submit. We have no means of driving demand beyond what is ordered, the spokeswoman added. While it is common for cities to calculate the cost of the plague, researchers have made such efforts. An Ohio State University study last year placed an annual total cost of the plague in the state, and this is just New York, at 6.8 billion to 8.8 billion. Unbelievable. A figure that includes lost economic productivity of those who died from overdoses. This month, health research firm Atarium estimate the cost of the U.S. epidemic to be $1 trillion. These people really don't need to talk about black folks. Okay. Seriously, they don't need to talk about us, because we are not putting no strain on the system to the tune of $1 trillion like these junks, and this is just from 2001 to 2017. $1 trillion. Now, I did an article on this before, but that's ridiculous. That's ridiculous. But this is what happens. This is the end result of calling it a public health issue. You see, it helps no one and drains the country financially. The addicts are still addicts out here, and you spent $1 trillion and they're still running around high. Calculating the cost of the opioid plague is valuable because it can help express the magnitude of the crisis, said Corey Ryan, senior analyst of Atarum. The firm has heard from municipalities around the U.S. that are trying to come up with cost figures, he added. By putting an economic number on the plague, it can be compelling to actors and stakeholders to make investments to resolve this crisis. It's not going to get solved. Not going to get solved, y'all. 20 years in the making, okay? Not getting solved. And that's the really pathetic thing. You done spent $1 trillion into this addiction, and it is still going stronger than ever. Still going stronger than ever. Again, you should clearly see that after spending $1 trillion on this drug plague, they still don't know what to do. They still don't know what to do. These people are just trying to throw the kitchen sink, and it's still not working. It's the sign of the times. Things are changing rapidly, and it's going to continue to change. And nobody's going to stop this change from happening. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell twice. And join me on Black Junction TV and blackspot.com. Peace, family.